Good afternoon, my name is Ricardo Zurita and I'm going to talk about upper gastrointestinal bleeding due to a peptic ulcer. Definition: upper gastrointestinal bleeding is a potentially life-threatening abdominal emergency that remains a common cause of hospitalization. Upper gastrointestinal bleeding is defined as bleeding derived from a source proximal to the ligament of Treitz. Peptic ulcer disease refers to painful sores of ulcers in the lining of the stomach or first part of the small intestine, called the duodenum.
This is Dr. Carlo Oger, emergency physician and founder of EDXitVideo.com. This video is about upper GI bleeding. Upper GI tract. This includes your esophagus or swallowing tube, stomach, and part of the small intestine. The causes. Sometimes, even with testing, the cause of bleeding is not found. Most commonly, ulcer. This is when the mucous membranes of the GI tract break down. Stomach acid wears through the membranes, then it can bleed. Also, enlarged blood vessels. These are called varices. People with liver problems can get high pressures in the blood vessels of the esophagus. When these vessels enlarge, they can sometimes bleed.
My name's Dan Rogers and I'm a consultant gastroenterologist at University Hospitals of Leicester. Today we're going 5% for those who suffer a bleed while in hospital for another reason. Although it may therefore seem we've made little progress in the management of these patients, the age of patients presenting with this condition has increased, and so the patients presenting tend to be sicker and managing a patient with active bleeding from esophageal varices on the left and an arterial spurt from a Julifoy's lesion on the right. Bleeding. Hematemesis is the vomiting of fresh blood, whereas coffee ground vomiting may be altered blood, but can also be due to a number.
Treatment includes the following: secure the airway, insert bilateral 15 gauge minimum upper extremity peripheral intravenous lines, replace each millimeter of blood lost with 3 milliliters of crystallite fluid. In patients with severe coexisting medical illnesses, pulmonary artery catheter insertion for monitoring hemodynamic cardiac performance, Foley catheter placement for continuous evaluation of urinary output as a guide to renal perfusion, endoscopic hemostatic therapy for bleeding ulcers and varices.
Cause the patient to vomit up blood, so hematoemesis. So now let us look at some common causes of upper GI bleeding, beginning with esophagitis, which is essentially inflammation of the esophagus. Irritants can cause inflammation of the esophagus as well as esophagus. Let's talk about Barrett's esophagus. But change in morphology, in shape. Findings reveal that there are goblet cells present in the area where they shouldn't be. The next condition.
What causes ulcers? No single cause has been found for ulcers. However, it is now clear that an ulcer is the end result of an imbalance between digestive fluids in the stomach and duodenum. Most ulcers are caused by an infection with a type of bacteria called Helicobacter pylori. Factors that can increase your risk from ulcers include use of painkillers called non-steroidal anti-inflammatory drugs such as aspirin, naproxen, anaprox, naproxen, and others, ibuprofen, and many others available by prescription. Even safety-coated aspirin and aspirin in powdered form can frequently cause ulcers. Excess acid production from gastrinomas, tumors of the acid-producing cells of the stomach that increase acid output. Excessive drinking of alcohol, smoking or chewing tobacco, serious illness, radiation treatment to the area. Though ulcers often heal on their own, you shouldn't ignore their warning signs. If not properly treated, ulcers can lead to serious health problems, including bleeding, perforation, gastric outlet obstruction from swelling, or scarring that blocks the passageway leading from the stomach to the small intestine. Thank you.